We are very, very concerned with the Biden administration and the HHS's recent, abrupt, sudden announcement that they are going to dramatically cut the number of monoclonal antibodies that are going to be sent to the state of Florida. Just last week, on September 9th, President Joe Biden said that his administration would be increasing shipments of monoclonal antibodies in September by 50%. And yet, on September 13th, HHS announced that it was seizing control of the monoclonal antibody supply and that it would control distribution. And then on September 14th, the announcement was more than 50% of the monoclonal antibodies that had been used in Florida were going to be reduced. So this is a dramatic reduction. And I'd say it's doubly problematic because what Shane Strom and folks in Tampa General and these other hospital systems that have been doing this, they're not getting it from the state. They get it. It's drawn down from, it had been AmerisourceBergen, so they get that. And then when they need more, they request more, they do it. What the HHS and the Biden administration is now doing is they're saying that all of the reduced amount will go to the state, and we're responsible not only for sourcing our sites, which we're happy to do, but any infusion center, any provider, any hospital will have to come through the state. And to just spring this on us starting next week, we're going to have to do that. There's going to be a huge disruption, and patients are going to suffer as a result of this. And so we're going to work like hell to make sure that we can overcome the obstacles that HHS and the Biden administration are putting in us. They say they're cutting it because of equity. Well, look, the South has had higher prevalence this summer. That will shift, and then as more states and other parts of regions need it, we understand that. But part of the reason we've used a lot is because I have made it a priority in the state of Florida. It had not been a priority at the federal government level for months and months and months. We saw the need. We saw patients that were coming in. We saw a gap in understanding amongst the population. 100% of our population knew that there were vaccines. I would be willing to bet probably less than 10% had a firm understanding of monoclonal antibodies. So we saw that deficiency. We saw a lot of physicians didn't even know that this was an option, and so we acted. We were able to raise awareness, and we were able to expand access for people, which is very important. That should be celebrated. I mean, if we had sat on our hands, just think of all the 90-plus thousand people that would not have gotten this treatment. Many thousands would have ended up in the hospital, and of course, some of them would have ended up dying. So it has saved lives here in the state of Florida, and the fact that we've led on this issue, I get people writing into my office from all these other states. Saw your press conference. I had no idea that this was something available. I'm trying to get it in my state. So the demand has increased because a lot of people didn't know this was out there, and now people far beyond Florida know that this is out there. So we're proud to have led on that. We think it's made a difference. We think it'll make a difference in these other states. But man, to just kind of pull the rug out from anyone a week after the president himself said they were going to be increasing the distributions by 50%, it's very, very problematic. What I am doing, though, is we're going to try to cover the bases. I had a call yesterday with GlaxoSmithKline executives about their new monoclonal antibody. How do you pronounce it? Sotrovimab. Yeah, I always mess that up. So Sotrovimab was given EUA, I believe, in May. So the Eli Lilly one, which is kind of now coming back, but the Regeneron, that was at the end of 2020. Sotrovimab was EUA in May. The clinical data on that was even better than the clinical data on the Regeneron, 85% reduction in hospitalizations. It is not approved for subcutaneous injection, so if we get it and we use it at our sites, we'd have to expand the amount of IV treatments that are available, which we're going to be willing to do. So now they do not have a direct purchase agreement with the federal government. Federal government's bought all the Regeneron. They just upped it for another shipment. Honestly, that should have been done many months ago. But we are not able to buy it directly from Regeneron, given that we do think we can potentially order some Sotrovimab, and we will do that if we can. It has been, the clinical data is great on it, and so we would be able to potentially use that to meet any of the shortfalls. But this is something that when you have something that has worked, you should want to continue doing that. We've been thrown a major curveball here with a really huge cut from HHS and the Biden administration. Even though you see the numbers, I mean, I think that we're all very happy where we are today versus where we were a month ago. Much better trends, and we've kept a lot of people out of the hospital. So we're fighting. We're going to make sure we leave no stone unturned. Whoever needs a treatment, we're going to work like hell to get them the treatment. And I am happy that even though the awareness of this has gone up, we've actually seen a decline in the number of people going to our sites. I think that's because there's less of a need for it, because the prevalence has gone down, which is great. And so hopefully that will continue. But we know that there's going to be people that need this in the interim, and we have a responsibility to be there for them, and that's what we're going to do.